Hey everybody, welcome to another edition of Ask Dr. David. Hope everybody's doing well out there. Um, as you know, if you hang out with me for a long enough period of time, I talk a lot about vitamin D and zinc. And so we're going to be doing a little bit more on the education side now. And I'm going to be spending today talking about vitamin D because people ask me all the time, David, why are you so into vitamin D? Why do you think it's so important? So I decided it would be nice to give you a little breakdown as to how I've come to the conclusions of why I think that vitamin D is such a very important nutrient and why we all should be very mindful of it. Now, I am also going to be putting on our Patreon page some other exclusive content where I will be talking more specifically about the types of testing, how I interpret the results, the types of dosing that I use based upon that as well. So, if you want to get a little bit more into a deeper dive, please join us over on our Patreon account. And of course, if you haven't subscribed and turned the notification button on for this YouTube channel, please do so. We are getting closer to 1,000 subscribers, and it's so wonderful to be able to share with everybody, and we want to just keep this truck going. So hope everybody will spread the news, spread the information to everybody, and that everybody joins our holistic family. Okay, so first of all, I get asked a lot what drew me, as I said, in the first place to this, and really it goes back to about 2008. And there were some early studies coming out in the pediatric literature talking about how vitamin D deficiency were associated with things such as asthma and diabetes and eczema. And prior to that, we were really just thinking about, I mean, nobody was checking vitamin D levels in the first place. You took the recommended daily allowance, and that was it. Then I started reading about vitamin D levels themselves and how important they were in terms of the effects that they can have on the immune system and on the body as a whole. So I started researching more about this. So when these first studies came out, and I was very impressed. And so one of my dear friends, who is a pediatrician down in South Florida, Lee Edelstein, and he is one of the people who reads every study that possibly comes out, and is really great in interpreting them and dig a deeper dive that I can in terms of some of the statistics. And so Lee and I actually we've known each other since preschool, so our relationship is just passing 50 years now this year. So when I showed him this information, he had said to me, well, I see the studies that you're talking about, and they look like good studies, but one of them is in Pittsburgh and one of them is in Toronto. And so those are in northern climates where, especially up in the winter time, people have low vitamin D exposure through the sun. And so, yes, this may be valid up there, but how do we know that this is really happening here in the Sunshine State? Which I thought that was a very valid question. That's the way that Lee is. He stimulates me to think further along. And I had said, I had done a few vitamin D levels, and they're not looking so hot here. But what I'm going to do, Lee, is the next 3 months, anybody who comes into the office who needs a blood draw, I'm going to ask if I can also draw an extra test tube for the vitamin D levels. And then we can see if this is an issue in the Sunshine State or not. So we did this, and I over these 3 months, I was able to collect 72 values for 25 hydroxy vitamin D. That's the level that we want to be checking. And of those, now all the research that was being starting to be shown was having levels above 50 nanograms per milliliter. And so of the 72, 68 were under that. Okay, so by that level, but even in terms of true deficiency, because if you look on the lab reports, it'll say normal is somewhere between 30 to 32 and above. And that was always felt to be the number that would be needed for proper bone mineralization. But 25% of my patients actually had values under 32 as well. So again, sunshine state, sunshine vitamin, it wasn't making the connection. It wasn't helping people out being in the sun. And of course, recognizing that with our understanding about skin cancer and not wanting to get sunburned, don't get exposed too much to the sun. Well, of course, what did that lead to? That led to a national, if not statewide, vitamin D deficiency because that's where we get how our body makes it. We'll get into that a little bit more in a minute. So, of course, people wear sunscreens, people wear clothing, people stay in the shade now, unlike when I was growing up back in the mid 80s when I was in high school. And at that point, we would go to I grew up outside of Fort Lauderdale. We were on the beach in Fort Lauderdale every single week. We were at most using Panama Jack number 4. Sometimes our friends, we would even use baby oil on ourselves. And needless to say, my skin was certainly several degrees darker than it is now. And thankfully I have not developed any skin cancer because of that, but I do have friends who actually did develop skin cancer as a result of what we were being exposed to. So again, we had great vitamin D levels at that point. I'm sure we didn't check it, but it had to be. But at the same time, what did we do to our body? And so that's why I kind of started coming around to the possibility of maybe we shouldn't be exposing ourselves to that much sunlight, and at the same time, get make sure that we're having enough vitamin D in order to cover this. So, of those 72 people, yours truly had the lowest value out of everybody, which is a level of 16. And I was, wow. I mean, granted, as I am in my medical office now, I don't spend a lot of time out in the sun, and I wasn't taking vitamin D at the time, just what was in my multivitamin. I think it was 400 international units, which was felt to be the recommended daily allowance at the time. And so my 16, and so at that point, I started taking a look at this because I had started suffering from asthma and allergies from about age 6. And for literally 15, 20 years more, 25 years, I was on allergy medications, on asthma medications, exercise induced asthma, cold induced asthma, viral induced asthma, allergies. I spent most of my childhood living on Dimetapp. That was the green stuff. I mean, the grape flavored stuff that we had growing up. I used to think of it was like our purple crack. It tasted delicious. I don't even, some days I think I probably would have even told my mom that I had some allergies just to get the purple crack. But anyways, Dimetapp, that was our friend. It would clear me up, and so that's the way of approaching it. And of course, as I became more involved in integrative medicine and functional medicine and looking for the root cause, I was like, oh geez, maybe this is why I'm having all these allergies and asthma problems for all these years, and it's not getting better. So I started taking 10,000 units of vitamin D based upon how low my levels were, based upon talking to a couple of colleagues and doing some research on that. Now, with taking that 10,000, I got my level up to 50 nanograms per milliliter, and which of course was kind of like the general goal, but I was still having allergies and I wasn't quite up into the higher levels that I was starting to read about, 65, 70 above that. So then I increased my vitamin D intake to 15,000 units. And sure enough, 3 months later, I checked my level and I was at 71. I'm like, okay, this is time for us to figure out what's going on here. Now, prior to that, I had done some allergy testing and knew that I was allergic to melaleuca trees, and which turned out to be tea tree, which I found obviously is in some supplements and hair products. And I found much afterwards that I had some serious reactions to that at the time as well. But I also, when I did an elimination diet, corn was the thing that set me off. And over the course of about 10 years prior to me figuring out my vitamin D, there were about a half a dozen times where I accidentally ate some corn. Once I was eating I didn't realize it was a Southwest egg roll. I thought it was an Asian egg roll, and there was corn in it. And certainly I started feeling close up in my throat, and I figured, oh, I just had something. And sure enough, that's what it was. Once I was at a more foofy kind of a restaurant down on South Beach in South Florida, and my nurse at the time, and everybody by that time knew about David's corn allergy, and said, "Hey, David, you know that there's some corn on this veggie pizza?" And I'm like, "Who puts corn on a pizza?" And he said, "Well, these guys apparently do." And sure enough, 10 minutes later, I started feeling the same closing up. I mean, there was a Publix next door pharmacy. I ran next door. I asked them for their prescription pad. I'm waiting for prescriptions for prednisone. I'm waiting for inhalers. I'm waiting for all these type of things. Grabbing Primatene mist off of the shelf in the meantime. I was able to abort that. But it was really feeling kind of like an anaphylactic type of reaction that I was able to abort. And as you can imagine, that ain't so fun to happen to your body or to your child or to see that with anybody. So he came around, got my vitamin D level above 70, and I said, okay, I'm going to try one piece of popcorn and see how I did. And I did not have a negative reaction to it. And by that point, I had been off of my allergy and asthma medicines because I wasn't taking the corn, and seemingly I wasn't having so many problems with the melaleuca trees at that point either. So that was no problem with one piece of popcorn. Next day, I decided, okay, I'm gonna have two pieces of popcorn and three. And so I started, and a few days later, I have a handful of popcorn, and then I started having some corn chips, and I'm like, oh. I am not having the same allergic reaction that I always had. And so sure enough, although I do low grains in my diet, corn was one I did decide to allow in my diet just for making up for lost time. Although now that I'm on a more low carb restricted diet, again, I'm not eating much corn anymore. But it's good to know that if there is something in a food that I'm going to eat accidentally that has corn in it, I know that I'm not having to run to the nearest drugstore or into my cabinet to figure out what I'm going to do to abort this reaction. So 4 years after that, actually, my vitamin D level, I checked. Hey, let's see where I'm at. I haven't checked in a while, and it went up to 91. Now, everything that the upper limits of normal was listed on the lab as 100. I decided, you know what? I don't know that I need to be up in the 91, so I lowered it back down to 10,000. That's where I am at now. It's actually still at 10,000 a day. I'm at 81 nanograms per milliliter with this. I'm like, okay, I'm going to hang out here for a while. I think I'm going to be okay. So it's been a little while since I've checked my level again, but I'm pretty sure that I'm doing all right with that. So that is my own personal story when it came to vitamin D. Okay, so now that I've kind of set the preface as to why I'm so excited about it, let's talk more about it. Now, of course, a good question is, what is vitamin D? Because vitamin D, it's actually very different than all of the other vitamins in that it's based upon a steroid. It's as opposed to all of B vitamins, it's not based upon those are not based upon steroids. Technically speaking, pardon me, pardon me on that. So vitamin D is technically not even a vitamin because you can make it and get it from the sun. What happens is that when the steroid, as it's processed a few times, when it gets exposed to the sunlight in the skin, it gets converted to 25 hydroxy vitamin D. And then once more, as it passes through the kidneys, it goes to 125 hydroxy vitamin D. And those are the active versions of this. And so, as I said, technically, you call it vitamin D. Technically, it's not a vitamin since, again, we don't have to take it through a supplement since we can make it our own. But nonetheless, it still has the moniker vitamin D, so we're going to still call it that. Okay. So now I want to talk a little bit about these why I find this so important. So I'm gonna do like I did a couple of videos again where I'm gonna do a little bit of a screen share and I'm gonna be able to show you some of the studies as to why I think this is so impactful. So I'm gonna get a little deeper into the weeds here, but I think it's important for people to understand as to why I'm pushing this so hard. Okay. So the first question, how does vitamin D affect bone mineralization? Now, I'm not going to show you a study, but that we all know about this. But basically, this is what the primary understanding of vitamin D was from the very beginning. Vitamin D, calcium, it's strong, good for your bones, so you can they grow big and tall and strong. Now, vitamin D actually is not only involved in the absorption across the intestinal lining of calcium, but also for phosphorus, which is also called phosphate, and for magnesium. But also the vitamin D is important in pushing that calcium and those minerals into the bones themselves. So it's actually a two-step: absorb it from the diet, put it into the bones. Okay. Now, when our calcium is super important, not just for the growing of bones, though, but all of the muscles of our body need calcium in order for them to contract. Every time that our heart beats, calcium is needed. Muscle contractions, calcium. So, in a way, bone serves as our storage, as our silo for calcium that our body can take it out of the bone in order to create these other, to perform these other metabolic importancies of our body. So we need calcium to come in from our diet in order so that we don't keep stripping it out of our bones because our body inherently knows it's more important for our muscles to contract, for our heart to contract, than to have strong bones. And so it will strip it out of the bones if it's not coming from the diet. And that's also the reason why we need to get it from our diet. But also, it's important to note that when people have really good vitamin D levels, they actually don't even need to be taking the full amount of for the recommended daily allowance. They can take less and do just fine with it because they're super absorbers at that point. In fact, you even have to be a little careful with your calcium intake because you could even overdo it if you have a very robust vitamin D level as well. Okay, so you still need to get those nutrients, not just the calcium, but those other nutrients need to be in the diet as well. Okay, so now here we start to go a little further. What effect does vitamin D have on neurocognition? Okay, now this is one of the, and I'm going to now flip over to my screen share. So here we go, share this, and so you should now be seeing that. That's a funky thing there. Okay, so this was actually one of the first studies back in 2012 that really drew my attention. Maternal serum vitamin D levels during pregnancy and offspring neurocognitive development. Okay, and here what we found is they looked at the vitamin D levels, and what they found here, maternal vitamin D insufficiency during pregnancy was significantly associated with offspring language impairment. Maternal vitamin D supplementation during pregnancy may reduce the risk of developmental language difficulties among children. Now, as many of you know, one of the very first populations that I started working at from an integrative functional medicine perspective were people with autism, children with autism. And so this to me was obviously very interesting because that's a very large percentage of children with autism, people with autism, are they're having language difficulties. And so, and this was also part of what really sparked my interest in my preconception to infancy program, our P2I program. That was that, when once we started getting kids better and the parents started asking, well, hey, maybe moms especially, maybe I have some of these deficiencies, maybe I have some of these issues. Let's, can I check myself for this? And the dad would ask the same. And so this was actually one of those very first things that said, well, gee, if we see here maternal deficiencies can lead to language impairment, well, it certainly would make sense to me that we would try to get the vitamin D levels even prior to conception, that's preconception, or during pregnancy or any point. But we wanted to make sure that the babies were getting enough vitamin D. So this, in a way, was kind of the hallmark thing that kind of triggered what then has happened for the next 10 years of my career. Okay, so that is the first thing, and so I'm going to consult my notes here as I flip through these here. Um, and so the next thing was a little bit further into this, and pardon me over here. Okay, and then we came up with with a more direct study here for vitamin D and autism, and this was a newer study in 2017. And what they were basically able to show was that the vitamin D levels seemed to be associated with deficiencies with developing autism. Here, two open label trials found high dose vitamin D improved the core symptoms of autism in about 75% of autistic children. A few of these improvements were remarkable. They were giving these children up to 300 units per kilogram per day and up to 5,000 per day. Okay, and they got to levels of 45 over nanograms per milliliter, of which I actually go towards even higher levels now that I've learned more. But again, this was something that obviously showed, and this was super important for me because again, my population of children with autism, and so this is one of the first things I go checking when we check blood levels. Pardon me. Okay, next question. How does vitamin D affect depression and anxiety? Okay. Now, vitamin D supplementation ameliorates severity of the severity of generalized anxiety disorder from a couple years ago. Okay, and here too we see here that vitamin D was effective in ameliorating severity of general anxiety disorder symptoms by increasing serotonin concentrations and decreasing the level of an inflammatory biomarker neopterin in these patients. Now, furthermore, the serotonin itself, the receptor for serotonin. And as people know, serotonin is very much affects our moods. When people take anti-depression medicines like SSRI medications, they are boosting the serotonin. But where the serotonin itself, the receptor, sitting right next to it on the neuron is a vitamin D receptor. And if there is not the vitamin D sitting there, then the efficiency when serotonin hits that serotonin receptor goes down as well. And in fact, that's the reason why it is now felt that seasonal affective disorder, why people, especially in more northern climates where they don't see the light of day, are more prone to getting depression during the winter time because their vitamin D is not there in the same manner to help their serotonin receptors work as appropriate as possible. Okay. Now another thing here. Okay, the effects of vitamin D supplementation on negative emotions, so anxiety, depression, bad moods, etc. Here they actually looked at a large number of participants, 7,500 here. Our results support the hypothesis that vitamin D supplementation can reduce negative emotions. Patients with major depressive disorder and individuals with vitamin D deficiency are most likely to benefit from supplementation. So, of course, a good study will always say we need to do more information about this, more to interpret it, etc. But here you'll notice that it wasn't just people with vitamin D deficiency. Pardon me, people with the depression and the vitamin deficiency were most likely to. And again, I try to not getting it to the levels of 30, but above 50 or even higher than that. But again, vitamin D deficiency plus depression, give vitamin D, good chance of showing clinical improvement there. Okay. Now, Another one, vitamin D in anxiety and affective disorders. Okay. Now, calcitrol is another form of vitamin D here. Significantly lower levels of calcitrol were found in men and women with depression, as well as age-matched patients with anxiety disorder. So again, both affective disorders, anxiety disorders, depression is an affective disorder. Again, being associated with vitamin D deficiency. So you're seeing across the spectrum why it's so important to have good vitamin D levels. Now, what effect does vitamin D have on immune strengthening? Okay, so for to this, the impacts of vitamin D on COVID infections. So I kind of thought, I'll show a little bit more about other things relative to the bit. COVID took a lot of this to light. So many more people, those not necessarily in the holistic integrative world, now know about vitamin D that did not know about it 2 years ago. And here, they were actually doing a systemic review and meta-analysis. Okay, so here, in conclusion, low vitamin D levels were significantly associated with a higher risk of COVID-19 infection. Okay, this limited, is a limited current available data suggests that sufficient vitamin D levels in the serum was associated with a significant decrease in COVID-19 infection. In fact, there was actually another study that I had seen that I didn't put it all here to be comprehensive, but I'm just reminded of it now, where they were actually showing the vitamin D levels, which correlate between where you are in the hemisphere. And so the horizontal line, the longitude latitude line that goes from about Georgia across Texas and over to South Carolina, California. Those people who live below that had better vitamin D levels, and that alone seemed to be have protective levels against COVID-19. So this is a specific reason in this day and age, even now, why we know this is so important. Okay. Now, another thing here, vitamin D deficiency in both the infection as well as clinical outcomes. Okay, patients with now this again was a nice size study. Where to here, a total of 1.4 million individuals were checked here. Patients with low vitamin D levels present an increased risk, so acute respiratory distress syndrome, so SARS, which is severe acute respiratory virus. Took me a while to remember that one. So one of the things that it can cause is acute respiratory distress. This can cause, flooding of the lungs through the pneumonias, etc. So patients with low levels present with an increased risk of being admitted to the ICU or dying due to infection and a higher susceptibility of infection and related hospitalizations. Now, one of the things that you may have heard us say throughout the entire pandemic, we have only had four patients. Three of them were infants under the age of about 3 months of age that were just put in for observation overnight, make sure they were cool. One was an older woman. Nobody went to the ICU, let alone, thank goodness, not a single one of our patients has passed away during the entire COVID pandemic. Now, granted, we do a lot of other things, and we've shared before what our immune protocol is. This is obviously a big part of it, but I do believe that having good vitamin D levels has a big part to do with what's happening in our general population. And this is again not just during for COVID. I'll show you a little bit more about influenza in a little bit, but if you remember when the swine flu epidemic happened, was that when my son was in fifth grade, sixth grade? I guess it was about 7 years ago or so now. And at the time, it was, if you remember, it was very weird because it happened in April, which was not when flu season normally is. And at the time, I was seeing my colleagues were telling me, oh, my pediatric colleagues out in the real world were telling me, oh my goodness, this swine flu is so bad. We're seeing 5 to 10 kids in the office every day. We're putting at least 5 kids in the hospital a week. And I'm like, really? Because during that entire time, we only had one person who actually came to the office who was sick and who was sick enough. One single person went to the hospital ER to be evaluated. Not a single person was admitted to a hospitalization during this. And again, zinc levels and other things that we do as well. And it's even very common that I will hear from a colleagues again, like there was time where like, oh my gosh, rotavirus, the stomach bug. Oh my God, it's so bad. And I'm like, really? Is rotavirus going around? Because we haven't heard about it. We're not seeing it in our patients. So again, yes, more likely to have in young children. Yes, you know, 99% of our patients are breastfeeding. The overwhelming majority past a year or longer. We know the importance of breastfeeding as well, and those antibodies as they're hanging out on the intestinal lining and the protective lining itself. So obviously, I can't pinpoint it to any one particular nutrient. But again, time and time again, what we seem to be hearing from our patients does not match what you are hearing on the news and what you're hearing about in the community as a whole. Okay, now also. And this was actually showing that when you have vitamin D supplementation, even if you give it right away, rapid vitamin D supplementation presented with better clinical outcomes. Okay. So, vitamin D treatment shorten hospital stays and decrease mortality in patients, even in those who do, including those who have the comorbidities. We've talked about the people who are high risk as well. Vitamin D supplementation is effective on various targets, parameters. Therefore, it is essential for vitamin D, for COVID-19 treatment. So again, very nice journal article from last year, just a few months ago. All righty, moving right along. And now, mentioned too about influenza virus. This was actually preventive effects of vitamin D on seasonal influenza A in infants. Randomized multiple trial here. So that what they had done, it wasn't as large of a study. They had 121 cases of influenza out of 400 infants who were in this random control trial. Higher doses of vitamin D is suitable for the prevention of seasonal influenza, as evidenced by rapid relief from symptoms, rapid decrease in viral loads, and disease recovery. In addition, high dose vitamin D is probably safe for infants. 1,200, that is 3 times what the recommended daily allowance is. Again, when we do our testing, and I would only go to higher dosings when we do this types of testing, but we certainly see infants are able to tolerate and do very well with higher doses there as well. Okay. All right. And then finally, how does vitamin D affect immune modulation? Okay. Now, this is where it becomes super interesting because we talk about how vitamin D seems to be able to boost up the immune system when it may need some support. But the other really amazing thing about this is that people who have hyperinflammatory conditions, people who have autoimmune conditions, it does the opposite. It modulates it, and it kind of brings those hyperinflammatory, autoimmune, inflammatory conditions down as well. So, how about that? It's whether if it's weak, it'll bring you to here. If you're too strong, you bring you to here. So you sometimes may have heard me talk about the Goldilocks effect of vitamin D. We don't want it too strong, we don't want it too weak, we want it just right. And it seems as if time and time again, this is what happens. So here, this is the emerging role of vitamin D in autoimmune diseases, an update on therapeutic implications. And what you will see here is the analysis demonstrated an inverse association between vitamin D and the development of several autoimmune diseases. So that means the lower the vitamin D level, the higher likelihood that you have these autoimmune diseases. The higher the vitamin D level, the lower likelihood that you would see these. And you can see that these are a bunch of different things: lupus, autoimmune thyroid disease, type 1 diabetes, multiple sclerosis, autoimmunity of the eyes, Crohn's disease, ulcerative colitis, psoriasis, rheumatoid arthritis, polymyalgia rheumatica, international. And so, again, this very interesting thing, all of those autoimmune systems. So, as you may know, when people come to my office and they say, oh, they can't figure out what autoimmune condition that I have. And from a functional medicine perspective, I'm like, I mean, you want to know if it's where it's coming from, especially when people have fibromyalgia, chronic fatigue. Is it lupus? Is it MS? And I say, from a functional medicine perspective, I don't think that it matters that much. It's all about what are your levels, how is your diet, how is your sleep, how is your exercise, how are you treating your body, right? How is your vitamin D level? So again, super important for us to know from that perspective as well. And then again here, now what the interesting thing here is this was also vitamin D, and they looked at it and they compared it with omega-3 fatty acids. You've heard me talk about omega-3 fatty acids as well. And what they found here, again, large study, 25,000 participants, pretty evenly matched between men and women. These are middle aged and above. And here, all they did was give vitamin D 2,000 units. They weren't measuring levels. They just basically said they give them a placebo or they get it. Now, they also gave omega-3 fatty acids. Now, you'll see here that they gave 1,000 milligrams per day. Now, I was taught that you need 3,000 milligrams or more to have an anti-inflammatory effect from omega-3 fatty acids. So what you'll see here is that it says vitamin D supplementation for 5 years with or without omega-3 fatty acid reduced autoimmunity by almost 25%. And then they said, while omega-3 fatty acid supplementation with the vitamin D reduced it by 15%, and it wasn't statistically significant for that. But it says both treatments showed larger effects than the reference arm who got the placebo. So vitamin D, big deal there. Omega-3 fatty acids, even at 1,000, made a nice improvement there as well. So that's my little tour for you relative to some of the studies that I've done. If you want to geek out on this and you Google vitamin D and disease X, disease Y, whatever, you will find so much research on vitamin D. It blows my mind that this is not part of every single physician's evaluation and part of their treatment. It's so many people when they come to me and like, no, they don't. They maybe they told me to take vitamin D. That's great. I'm glad that they told you that versus not telling you that. But what is your level? I remember when Dr. Fauci told us that he was telling that he was taking 5,000 units of vitamin D per day, which was awesome. I mean, if everybody across America took that, we would see some significant improvements in a lot of people's health. But after I said, well, thank you for saying that, and that was like in September of 2020, I believe. But then I remember like yelling at my computer the next moment, "What's your level, Dr. Fauci?" That's what we really want to know. What's your level? And you should tell everybody else to check their levels as well too. Of course, he didn't hear me through the computer, so I guess that never happened. But anyways, okay. So now the last thing I want to talk about, and let me come off of the screen share here. Stop sharing. There we go. So now you're back to me. Hopefully, if this is all working right. Now another question that also comes about is, are other supplements needed when vitamin D are measuring at higher levels? And the answer to that, and you may have heard about this already, is vitamin K. Okay. Now, vitamin K is needed to properly move calcium into the bones for storage so that it's not just hanging out in the bloodstream. Why could that be an issue? Because we were talking about how you need calcium in the bloodstream for your heart and everything, but too much calcium there can cause calcification. So, as you may know, with people who have coronary artery disease and with it's not just cholesterol that causes the blockage, but there's calcium and inflammation that's in the lining of these walls too. So, especially if you've seen me as an adult patient, you may very well have even heard me talk about doing a calcium score for looking at cardiovascular disease. And we have now found that having calcium in the lining of the heart vessels, carotid arteries, etc., that is what can lead to roughness, and that leads to cholesterol in the building up of plaques. But even people who have higher cholesterol levels, if their calcium level is zero and they're not having any other cardiac symptoms, they may not very much need to do statins, etc., as long as their calcium score level is a zero. You'll be pleased to know that yours truly does carry a calcium score of a zero as well. And so my cardiologist had said to me, "Hey, at this point, being in your 50s, your heart is probably not going to be the thing that takes you out, because thank God everything else with my treadmill test and my EKG and all the other stuff was doing well as well. But he said something else is going to take you out. It ain't going to be your heart." So that was kind of cool. So that's why that's kind of an important thing. So now, vitamin D also promotes the production of vitamin K dependent proteins. Then, of course, you need the vitamin K to be there. So if you have enough vitamin D, if you don't have enough vitamin D, those proteins don't work very well either. Okay. Now, here's the interesting thing about it. Do all people need vitamin K? Now, it wasn't until more recently, I'd say in the past year or two, that I started adding vitamin K to my regimen when I learned more about it. But interestingly, for the first more than a decade of me taking these higher dose vitamin Ds, and I never had any of that calcification happening to my heart as shown by my calcium score, unless the vitamin D came in and magically cleared it all off. But the vitamin K, but I can't say that that is for sure. But again, going forward, at least I know that from a cardiovascular perspective, from everything that I'm doing, seems to be doing just right. All right, so there you go. That's our deeper dive into why vitamin D is important. Again, if you want to get an even deeper dive, and we'll be putting this into our education station on our Patreon account. So again, if you want to learn a little bit more about how we test deeper and how we treat for the vitamin D, we'll be posting that information over there as well. All right. Well, I hope you now know everything you need to know about vitamin D and then some, and that you'll tell everybody about how important this is, and that you'll share this video so everybody knows how important vitamin D is and why we need to get this right. So to your health, thank you very much for joining us. Have a great day.